Hi, everyone, and welcome, and thanks for joining us today. While we wait just another moment for folks to finish joining, feel free to drop a quick hello in the chat section and let us know where you're signing on from. My name is Melanie McGacken, and I'm honored to be representing the Community Living Education Project through Rutgers University, or we're known as CLEP for short. I'll be your host for today's session. Before we dive into the presentation, I want to take a moment to share a little bit about who CLEP is and the work that we do. CLEP is dedicated to assisting and empowering people with intellectual and/or developmental disabilities to live lives of choice within their communities. We work closely with the person, their family, and professionals in their lives. CLEP focuses on taking a person-centered approach to help people explore all possibilities in community living. Our team draws from our professional and lived experiences when working with families. Many of us happen to be family members ourselves. And the best part about CLEP is that all of our supports and services are available at no cost to you, thanks to the support from the New Jersey Division of Developmental Disabilities, also known as DDD. We'll share our team's contact information at the end of today's session so that we can follow up with any questions that you may have about our services. Just a quick note about today's session. To keep the sound quality as clear as possible, attendees' microphones will be muted. However, we want to keep today's webinar interactive. We're here to learn from each other, so feel free to ask questions, share your thoughts or resources, and engage throughout today's presentation. You can do so by using a Q&A or chat feature in your Zoom control panel. Now that I've successfully stalled long enough for everyone to join, let's get into today's topic. Sensory-friendly emergency care and lab services, enhancing care for patients with disabilities. We all know that emergency medical care and lab services can be overwhelming for any of us, but for individuals with autism, sensory sensitivities, or other developmental disabilities, the experience can be especially distressing. Today, we're excited to be joined by Michael Smith from the Shore Medical Center, who will be able to share how they've transformed their emergency department and lab spaces to be more inclusive and sensory friendly, not just for pediatric patients, but for adults as well. You'll hear about practical steps that they've taken to create a more supportive healthcare environment for people with various support needs, along with additional services that Michael supports. At this time, I would like to welcome Michael Smith. Michael, thank you for joining us today.
Hey, thank you. And thanks for having us on board. We might be joined with our director shortly also. Looking at everybody who's coming online, great spread of people. And I'm seeing a bunch of South Jersey folks too, so that's cool. So we're the Shore Medical Center down in Somers Point, New Jersey, not to be confused with that large one up north. And I'm going to kind of just introduce everybody to the sensory program that we've established here at Shore Medical Center. Melanie's going to be helping me with the slides because my computer wasn't acting right. So Melanie, we can go ahead. So basically, 2019, there came a point at our ER that we decided that, well, we asked the question, is there a need for sensory-specific care in the emergency department? And that stemmed from an incident that not an incident, but a patient that we had here that he was an autistic young gentleman, came in to be seen. We have a pediatric care center in our department, so I should just kind of give you a little landscape. We have a pediatric ER, and our inpatient is also in the emergency department. So the nurses cover both areas. So this young man came in, and I think everything that could go wrong went wrong with this guy's care. We weren't able to work with him well and address his sensory needs that he had. So next slide. You can move on. Next slide. So need exists, absolutely. At about the same time that this patient came in, the Emergency Nurses Association had published a paper about working with patients with sensory needs in the emergency department. Today, per the CDC, 5 to 16% of the population have some sort of a sensory processing disorder. Let that be PTSD, and all sorts of things. 1 in 29 people have autism, and that's in New Jersey. When our program started, it was 1 in 35 patients or people in New Jersey had autism. So we did a self-assessment of the department, kind of looked at what we have, what can we do, how can we make things better, and it was kind of circulated on that paper that ENA had posted. So our director got together with the Atlantic County Special Services School District. They've been an amazing help for us, and they helped us to launch and develop the program that we have now, and they continue to work very closely with us. And then basically, they led us to be the only hospital that had sensory program in South Jersey. Next slide. So again, that started in 2019, that whole endeavor. And as we were getting ready to launch and begin that program, we got into 2020, and that was COVID. So that basically kind of put a squash on it for a little while. So April 1st of 2021 was our official opening for the sensory program. Was the only dedicated sensory room in Atlantic and Cape May counties, and it was basically we had charitable donations that were able to make that happen and make it possible for us. Next slide. So the purpose for our care center or for our pediatric program was to provide specialized care for pediatric patients with sensory needs, give them a safe environment, and we wanted to be that emergency department of choice for anyone with sensory needs or their families in southern New Jersey. Next slide. So the features of our program, the pictures that you see are for our pediatric sensory room. It's a quiet area in the department. Emergency departments, well, we're notorious for not being quiet. So the way we're set up with the inpatient area, we were able to find a quiet room. We used one of our inpatient rooms, so it's in a corner of the department, and we were able to designate that for sensory. The patients and their family have a designated parking spot that's out front. It's closer, shorter walk to the emergency department. Features inside, the top picture is a tactile wall with a chair. So if they need some sort of like a sensory feedback, they can kind of sit there, kind of put themselves at ease a little bit. We put in a very large smart TV that we could put various things on. Bluey is a very popular one with our patients, but also bubble walls, lava lamps, aquariums. All of those are great distraction devices that tools that we can use for them. There's a ceiling projector. It doesn't show so well in this picture, but we have various slides that we can put in there. The room color was selected by our friends at the Special Services School, and then also the lighting. ERs are always notoriously bright. It's either bright or off. We're able to adjust the lighting in the room to kind of make it a more friendly, calming experience or environment for them. Next slide. So, of course, the big thing, we've got the room, we've got the tools and the adjuncts, but you need the education. So the Atlantic County Special Services School District, their team, put together a program for for the department, and actually now for the hospital. It's about a 90-minute long session where they're going to go over different things. They're going to explain what are sensory disorders, and they're going to give some examples. They've got some great videos that kind of can put everything into perspective to the staff. They developed storybooks for us for communication, and they teach the staff how to use those, how can you use the televisions, how can you distract patients to be able to get everything done that we need to get done. Tablets, we have tablets that they use at the school also. It's the communication board tablets that we have them in hospital also, so if they don't have it with them, we're able to use that. And then also, how can we effectively use adjuncts like the TV and the slide projector for caring with these patients? Next slide. So pediatric, it's been up and running. It's been great, very well received. So next venture was our patients are getting older, and we're seeing adult patients with sensory needs. So we applied to the Eagles Autism Foundation, and they gave us a pretty generous grant that we were able to launch an adult program now for sensory needs. Next slide. So the features, this is the picture of our room. It's, again, we had to find an area in the main emergency department that was a little bit quieter, a little bit more out of the way. So we were able to find that room. So we've actually walled it off. So it's a private room. We have that same or similar smart TV, a little bit smaller. The room coloring, dimming lights, all the adjuncts that we have for pediatrics, we were able to duplicate in for here. Next slide. And then we moved on to sensory-friendly outpatient testing. One of the common things that we were finding, patients or their families were coming in, or their caregivers, in talking with them, was that, you know, they haven't had labs done for years, 3, 4, 5, 6 years. And that was because they weren't able to get it done. They would make the attempt at some outpatient locations, and it just wasn't able to happen. That's the environment's not good enough, or they weren't equipped to really be able to provide the to be able to draw the lab. So, with that, the gentleman that you see in the one gentleman you see in this picture, his name's Mike Monachetti. He's a businessman down this way. He funded our sensory friendly care lab, outpatient lab. So this is a lab. It's not in the department. It's actually in our outpatient area, and we can do blood work. We can do ECGs, EKGs in there, and kind of it gets them definitely out of the emergency department, and they can walk right into there. We've used this. This opened in July. We've done, I think, 8 sticks in there, or just this morning we did some swabs also. So, and the response has just been overwhelming with that. Oh, yeah, I'm sorry, April is when we started doing that. Next slide. That's a little bit of a picture of the sensory room. This is a better picture of that slide projector that's on the wall in the picture to the right. And again, just like in the rooms in the emergency department, we've got all sorts of adjuncts, whether it's tactile tiles. This ball that our director is holding in the picture on the left is a huge hit with all of our patients. The TV, we have a sensory TV or a smart TV in this room as well, that we're able to use for whatever the patient, the child, or an adult would prefer to see. Next slide. So different adjuncts that we use, and this is throughout the 3 areas of care that we have. Stepping tiles, they kind of squish and the colors change on them. They're great for distraction and bringing the child or the adult down to the room that we're working in. The communication boards, iPads, fidget toys, various ones, weighted blankets. We have a beanbag chairs, and if it's light or sound that is a trigger for them, we can address those as well. One of the big hits that we have, you see that alligator on the bottom. That's always great for them to stop by and kind of just get their mind off of things. And again, this has been a big hit that we've been able to get them into the departments or into the areas. It's going to take longer. I mean, you know, we can't move fast with this group, and we are more than prepared to just take as long as we need to kind of get them into that area as trauma free, or yeah, trauma free as we can. Next slide. So with the emergency department areas, we established an arrival process for them, for patients to come in, and that's going to help us to prepare for them, because we have a variety of ways that we can care for people and address their sensory needs. So we want to be prepared for them. We want them to walk in and the environment's ready for them. When they arrive, the waiting room might have a lot of patients in it, or it might be a little bit crowded. But when we know they're coming, we're going to get them directly into the department, into the bed, and avoid the noise and the chaos of a waiting room. So we'll be ready for them. They're going to tell us when they arrive, and we will walk them directly into the department, whether they're going adult or pediatric. Registration will come in. They will bring them their computer bedside, do all the registration that they need to do there. Next slide. And this is kind of what it looks like. We'll take a pre-arrival call, and it'll either come into pediatrics or to the department charge nurse. We'll find out what is it is it bright lights? Is it, do they want weighted blankets? Do they want certain thing on the smart TV? We'll have that all ready. We'll get them into the department. Security is also on board with this, room registration, and then the team will know that they are here. Next slide. In addition to all of this program, we use, oh my gosh, I can't remember which charting program we use here. We use FirstNet. And through that program, we were able to set up a little bit of an identification system for any patients to come in with some sort of a sensory need. So this is kind of what that icon looks like. So when we view our tracking boards or in the patient chart, that will be present, and that'll tell us that there's a note in the chart that can tell us that this patient has a sensory need and what that need would be. That way, if we're doing a pre-registration or something like that, we've already got it documented and we can refer to it. It's also going to allow, say, we have the patient in the emergency department and lab or x-ray have to come in to do a test. They're going to know, they'll see that on the board. They'll be able to go to the nurse or the provider and see, okay, what's going on and how can we prepare and what can we do to make this easier for the patient. And this will stay on the chart. Once we attach it, it would have to be manually removed, but once we attach that to the chart, it stays with them. So it'll pop up every time they come for return visit. Next slide. Community outreach is a big part of our program as well. I don't know if anyone, it was 2 years ago, we did a poster presentation at the Emergency Nurses Conference. I know I met a bunch, I saw some Voorhees people out here. So we met up with Virtua folks, as well as some other hospitals. We spoke at the ENA conference. We also present at the National EMS Conference that's in New Jersey here in Atlantic City. So we've done presentations there. And then I also take the presentation to some of the EMS departments in the area that serve and that come to our hospital. I developed a program. It's a 1-hour presentation on how they can address sensory needs pre-hospital. It's one thing for us to be able to do it in the hospital, in the controlled environment of, having the rooms and all that stuff. But EMS has to go to the house. They've got to go to a scene and get that patient safely into an ambulance and safely transport them. So a big part of our program has been involving EMS. I come from an EMS background, as does our director, Sherry. So we're able to kind of relate to them and do that. So I went also, and anyone that has a New Jersey certification, they're able to get a CEU for their recertifications from this presentation. In conjunction with the education, we develop sensory boxes for them. So it's basically a small box that has some adjuncts that they can use to work with the patients pre-hospital. Next slide. I think I have a picture of it. No, okay. So that's our poster that we presented. Too much to read, but it was the poster presentation that we did. Next slide. And then here's our sensory kits. So this was me doing the presentation at one of the squads down here called TRICARE. And then the sensory kits, these are the kits that go on the ambulances. It'll contain the ear covers, eye covers, communication boards, and various adjuncts like cush balls, different sensory adjuncts. And what we'll do also with them is weighted blankets as well. And what we'll do is when they come to the hospital and say they use the weighted blanket or the ear covers, we'll replace it for them when they come through. Next slide. Features of our outpatient lab. There's a sound box that we can use in there. A lot of the people that come in, they love underwater themes, whether it's the aquariums and stuff like that. So we can just have wave sounds on there. The chair that you see in the middle there, that was a vibroacoustic chair. It's kind can kind of do some vibration with sound and stuff like that. It's rather comfortable for them, and it's easy for us to work with. Below that is, instead of the alligator, we went with the shark for that distraction wall. Um, Other thing we use is this busy bee, which is in that upper right, or buzzy bee. That's kind of a used to reduce pain or discomfort with the needle sticks. So the blue part that are the wings are actually ice packs, and then it actually vibrates. So it kind of helps take some of, gives them some distraction from the needle stick that they're going to feel. And then those tiles that I mentioned we walk on, those are below that buzzy bee. They kind of squish, and everybody loves to walk on it. Even the adults, all of us will step on them as we're going down there, just because it's fun to watch the colors kind of splat around. Next slide. Part of the outpatient program that we have, or process, is we have a sensory care conference. What we will do is, our phone number's out there, it's published, gets spread about. And what they'll do, they'll call, they'll leave a message on a dedicated line for the sensory outpatient lab. Well, the leadership from the emergency department, myself, Sherry, our ER manager, and somebody from admissions will have a phone conference with the parent or caretaker, whomever's making the call. We're going to learn about the patient, get the regular information, name, date of birth, and then find out, all right, what's their sensory need? What is it, how can we help work with them? Is it, is it needle phobia, or just crowded places, stuff like that. And then a lot of times we can identify ways that we're going to be able to care for them. Some of them, they love Bluey. Bluey's a big one. We had a Bluey party, actually twice. This child came back almost a year to the date for a second blood draw. So we'll do a Bluey party, Mario Kart, different things. So we'll have little things for them also, and it just helps kind of give them more comfort with the room. And another thing that we've identified was pre-medications. So a lot of times the patients are prescribed a pre-medication before needing a test or a blood draw. Let it be Xanax, even Versed, something like that. The parents we identified are kind of, or the caretakers are almost scared to give the pre-medication. They don't know if it's going to interfere with the test that they're having done, or they fear that maybe they'll get tunded or too weak or tired to be able to put them back into the car. So we have a great conversation with them about what that medication is and how to properly use it, because they're a little bit nervous with that, and that has actually helped quite a bit with keeping them a little bit calmer for coming in to see us. During that care conference, they're also going to send the prescriptions that are needed via email to our admissions. And one thing that we've also identified is labs come from multiple, or lab requests are coming from multiple providers, whether it's psychiatry, primary, specialist, neuro. So we try to gather all of them together and get them all together, and that way, they don't have to worry about filing through all these different prescriptions. And then we'll give them directions on how to arrive for the hospital, contacting us, where to park, and how we'll meet them. Next slide. So another thing for our community outreach is we have a community advisory committee. This group meets quarterly. It's made up of all sorts of people. We have organizations from throughout the area, one like Autism New Jersey, Risen, that's down with Rowan College. They're going to work with us. Downs 21. They're all coming out. They participate in this committee, and it's also made up of family members of kids that have autism or some other sort of sensory disorder, and they're going to help us guide our program. They're a big part of our QA/QI, so we can discuss community needs. They'll provide us input for patient care. What can we do? How can we change the program to make this better? it's a constant process for us to want to improve this. Um, and then uh, any recommendations? The outpatient sensory lab directly came from this committee. That's came up as a discussion and got the wheels turning, and we were able to make that happen. So, um, and then any other projects in the future, they're gonna help us develop and identify what we need to do and work on. Next slide. And like I said, so also police departments and EMS are also a big part of the community outreach. It's a great way for the families and caretakers to meet with the police departments and EMS to express their concerns for different things that they've noticed. The police departments, the blue envelope programs. I'm not sure if everybody has that where you are, but that's something that's really launching down here, and that's kept in the car so that it can identify that somebody with a sensory need is in the vehicle. So the police know to take a different approach to this car. And same with if it's involved in a car crash or something like that. So it's been great working with them and getting their input and participation in this as well. Next slide. And pretty much that's all I've got for you guys. I wanted to thank everybody for you know coming out, hearing what we have, and I saw that the chat was blowing up, but I wasn't able to pay much attention to that. So I mean, I'll take questions.
Michael, we have a lot of positive comments coming in. People seem really impressed about what you've set up. You and your team have set up down at Shore Medical. I'm looking here. We have one question that came in. How do you deal with non-New Jersey residents? What if the individual is mandated to a certain lab?
Okay, so all right, the patient that I said we had the Bluey party for, who's been here twice, this year and last year, they are from outside of DC. So they're down Virginia residents, and they come up here in the summer for to get away. To the child, she actually is on a transplant list, so she's got to get labs done quite frequently. So they come up, they're out of state. Basically, what we'll do is during that care conference, they can discuss insurance or whatever, where they're from with our admissions, and she will right then and there identify if it's covered by insurance and what we can do. So that's why we want her there, is to help with that barrier or potential barrier that might show up.
Fabulous. I think I will share that myself and one of my coworkers,
Oh,
Natalie, had
Elizabeth
the
just shared the story. Yeah.
honor. We had the honor of being able to tour the program with Michael after one of the professionals that Michael and our team collaborate with shared about the unique situation that they are arranging for. And we were so overly impressed on the person-centered approach that the program takes, and really takes an individualized approach with every individual and family that they are working with. I really wish that this program was available when my son needed it most, and I think that really would have prevented a lot of that medical trauma that he had to go through with all the testings and hospitalizations and so on. I think that this is going to be a great benefit to many individuals. With
Yeah,
that
we've
being
we've
said,
really been able to fill a lot of take care of a lot of needs. Like I said, with the labs alone, we had one that came in. I think it was 7 years since he had a lab. So, and we can help put them in touch with other resources as well.
absolutely. Um, With all that being said, you are in South Jersey. We know that a lot of families will absolutely travel for this service. Are there any other hospitals or programs that you know up north offering something similar?
There was it? There's a hospital in Edison, I believe, was autism certified. I believe their emergency department. I remember hearing something to that. Aside from that, I'm not too certain. Listen, it's difficult to dedicate a room of an emergency department. Between holds and just constant volume, it does get difficult. And sometimes we're going to get more than one child or adult with a sensory need. So we also have a cart that we can move throughout the department, room to room, if we need to as well. We don't have the luxury of the big, like the smart TV for them, but um, we are able to kind of go a little bit mobile with it too. So.
Yeah, one of the things that really stood out when we were touring were the one cart that you had, and you had the picture exchange for
Mhm.
people who may not communicate verbally. But it really seems like you have a lot of practices in place to be able to support everyone who is coming in there, no matter what their ability or needs would be. We have someone asking, can you talk a little bit more about the award that the hospital received through JCAHO? The person thought that was really impressive. Can you talk a little bit more about that?
Was that the diversity? I believe it was.
Let me go back
Um,
to that page also, just so that we can, and I apologize, I have my questions on the screen, so let me just move those over here. Let's see. We will find
okay.
information on that, and then we can always send that out in our follow-up email. And just,
Yeah.
I know we have had a lot of questions, people asking if this is being recorded. It's absolutely being recorded. So this is something that we can share with you over the next week or so. Everyone who's registered for the presentation will receive a follow-up email. That email may come from my name, Melanie McGackin, or through the Rutgers Community Living Education Project, or through CLEP. So look for that email. We're going to have a copy of all the slides that Michael showed today. We'll also have a recorded version of this presentation. And feel free to share that presentation with anyone that would benefit. I know through the Rutgers Community Living Education Project, we work with a lot of families who are accessing residential options in the community. So I think this would be a great option for a lot of these residential providers, for individuals, whether in provider managed, self-direction. This is a service that a lot of people will be able to access who may be struggling otherwise. Let's see. I'm
And
just
we're always open if anyone wants to reach out to us. We will. We'd love to have discuss more, or if you want to come take a tour, see what's up. If you want to join our community advisory, more than welcome.
great, great. And we have Patricia's asking, can you share a little bit more about the education that you provide to providers, nurses, security, and
Sure.
registration staff?
Yep. So the basically anyone that's going to come in contact with the patients that come in, we're offering the education to them. So from security to registration, they're all getting trained in this with the special services school. So what they'll do is they go over how, but the big need was that, I mean, as far as I know, nursing school, EMT school, paramedic school, none of them offer anything specific to working with anyone with sensory needs. So the school was able to develop this program for us, and kind of gets into a lot of working with autism. Yeah, just because that's a big one that we're seeing, and the spectrum of it, and kind of basically just teaches them about, teaches everybody, well, what is autism. And it gives some great examples. They've got this one video in their program that's just very, very good, that kind of puts you in, it shows the perspective of somebody who can get sensory overloaded and stuff like that. So they go over that with them, and then they teach them how do you use the communication boards, or Kind of how you got it, going slower and being more with giving not instruction so much as telling them, this is what's going to happen first, then this, kind of how we're going to proceed through it. We have the picture boards that'll show you something like getting an X-ray. It'll show you, get in a wheelchair, somebody going into the X-ray room and being at the X-ray table, coming back to the room. And even just simple as getting vital signs taken. So we have, the group is going to, they teach them how to utilize all those different communication adjuncts that we have.
Wonderful. And if everyone wants to look in the chat, I will make sure to put this in the follow-up email. But Elizabeth, one of Mike's colleagues at Shore in the marketing department, she shared a link to this story that a family was kind enough to let them share about their experience from a few years ago. So that link is right in the chat section. Again, please make sure to go in there, click on that link. It'll open up a separate screen for you so that you can read that following the presentation. Let's see. We have so many compliments coming in, Mike, for this program.
Thank
I
you all.
do I do also see in the chat section that there are a lot of recommendations, either with links or through naming different centers that may be more accessible up north. One out, Lauren shared one out in Hamilton, the Robert Wood Johnson Integrated Health and Behavioral Health. She shared a link for, looks like Dottie shared for Valley Health. She shared an article about Joey's friends and navigating supports. I'm looking to see, there were quite a few recommendations coming in, right? And this is exactly why we love doing these information sessions, because it's these moments that we get to learn from each other about additional resources that other people can access.
I'll tell you one thing also. We've been working with Autism New Jersey. They've been a great partner with us as well, and they're currently working on putting a self-assessment tool together for healthcare and of different levels, say from hospital down to a family practice level. So they're a really good resource that we've been happy to work with as well. So there's if it seems like there's a lot of resources starting to come about. So, and we're happy that we're able to, be a big part of getting it going.
Mike, someone actually mentioned this being a valuable resource for someone with dementia. Is
Yeah,
would
I mean, it
it
could
be
be
relevant?
because, we have to work with some distraction. I would say there might be a little bit more difficult, but you know what? Some of the adjuncts could absolutely work. One of the pictures you might have seen was the lap pads that they use with the different button zippers, Velcro, different activities that we often use for dementia and Alzheimer's. We're using, that's one of the adjuncts that we'll use to help with our sensory clientele.
Mike, can you talk a little bit more about what I'm going to call, I guess, the pre-intake process? When Natalie and I were there, one of the things that the Community Living Education Project really focuses on, any families that we work with, is trying to do a person-centered tool called a one-page profile, where we really get the things that people like and admire about that individual. We have that individual participate with them, their family, and whoever knows them best. Give some information on what brings that person happiness and joy, right? The things that they like doing, their interest, how that person wants and needs to be supported also. It sounded like your intake process was very similar to that. What are some of the questions that you would ask?
Sure. So this actually this worksheet was actually where the Special Services School District helped us with creating this, and well, we asked them, well, one, what's their diagnosis? Do they have autism? Do they have PTSD? Is it just anxiety? So we'll go from there, and then what is it that we can employ or use to help make this a better experience, or at least as calm of an experience as we can. So if it's, they say, a perfect example would be the Bluey or SpongeBob or any of those shows. The young man that we did today, that we had in the lab, he's a big Eagles fan. And so on the smart TV, I had the game from Sunday, the highlights just playing, so that he was able to just fix on that and kind of get comfortable and acclimated with the room. Um, Pre-medication is another question that's on that sheet. So that way we know, and that kind of starts the conversation. Sometimes the caregivers or parents forget about that. They're like, oh, oh, they did write this prescription, but it's 10 years old, 5 years old, something like that. So we can also talk with them and say, well, this is an outpatient lab. We can't prescribe it, but we can help coach them and tell them, well, have your, contact the provider, or, kind of get it updated or something like that. Um, and that's like a lot of the do. And then what labs need to be done? Do you need an EKG? And do you need, which specific labs are they looking for, and from whom?
And from a parent's perspective, right? So often that is the hardest part of the visits, is that wait, right? Once we get there, it's that wait so often. And it really sounded like if families have that an appointment, you guys have that room set up, right? You know what
Mhm.
labs, you already have those tubes, pulled and labeled, whatever
Oh yeah.
that might look like. Reducing that time, it sounded like your team's actually waiting for that person, right? To walk
Oh,
in.
they are. We have two of our lab techs. One of them's the supervisor. They are in love with this program, so they're always making sure that they're available to help us with any labs. So once we get those prescriptions and we receive them, admissions will email everybody that's involved and say, I've got everything. It's all in the computer. Here is their encounter number, and the lab will then have the tubes pulled and ready. Labels are ready to go. And we just have to get in there, and they acclimate the patient to them, and then they get it done.
Fabulous. Fabulous. So I do have Michael and Sherry's contact numbers on the screen. Michael, if someone is looking to possibly do a tour, is that something that they can reach out to you directly for?
Absolutely. Yep, absolutely. We'd be happy to share the program. And I mean, it's needed. It's, aside from here, I also do, some EMS work, and I go to other hospitals, and it's needed out there.
Absolutely. I think when Natalie and I toured with you, we saw the benefits for the families and the individuals' perspectives. But I also, we saw by the end of the tour how this information can really help other hospitals and facilities maybe set up their environment in a way that'll be more sensory friendly if they weren't already doing so. And again, I would encourage everyone to look through that chat section, see all the resources that other families who are and professionals who are joining us are providing for you, maybe something closer in your area, but absolutely Michael's program at Shore Medical is definitely a great resource for families. Um, there were a lot of other questions coming in, but I think most of them were already answered. So if there are, we're going to give everyone another minute. If you have a new question, please feel free, and we will try to get that answered for you. Let's see, I'm just checking this other, I do see some more coming in. Do you ever find that the pre-meds become unnecessary because of the sensory friendly approach?
That I don't know. Because I'm not sure. Because I don't know if how they were before. I don't know if it helped take the edge off or not. Sometimes the dosing that they have might even be a little too low for that to really help. But I mean, both, and we don't get a lot with pre med. There's only been a couple, and in fact, the last one we had, they left an outpatient and came into the emergency department to have them drawn, and So yeah, we've only had a couple, maybe one or two adult that kind of needed something because they just had such a bad needle phobia. But then I think the one left saying, "Well, I don't think I need any of that anymore." So not the blood work, but any pre-medication next time. So
Right. I think again, that individual approach that you're taking quite often is going to pair that environment with more, right, preferred experiences, conversations, visuals, that over time, I'm sure you'll
yeah,
be able to tell over time, right? Now
yeah,
that
that's
you're getting
key.
those repeat patients coming in, if if the experience is getting easier on that individual or family. So
Yeah, it's the key to it is, just patient centric, and it's all about them. Like, it's always all about them. And with this, you really need to get to know them. In an emergency, I mean, we have 20 seconds, 30 seconds to really get to know somebody before we got to get to work or determine what's going on with them. So the heads up, and part of the EMS education also is that notification. A lot of them they're really good with calling and saying, "Yeah, I've got a 70-year-old with chest pain. We'll be 10 minutes out." But with this, they need to delve a little bit more, and that's part of the education that we give them, is letting us know, well, how far out are you? So we have time to prepare a room, but also what is it specifically they have going on or that they need, so that we're ready for them, just so that, we can make this as easy and seamless for them as possible. So,
and I love that you pulled in the special service schools to help guide you with some of
mhm.
those best practices. I know that the social stories that with those visuals of what the rooms look like, and so that maybe the professionals working with the individual and the families can best prepare the person of what that day may look like, right? And what
Mhm.
they can expect. And I think just having the photos of what the rooms look like is going to bring some comfort to some of the people that you serve.
It does. And there's been suggestions for us to expand that. We're trying to look into doing that, and that's what we'll probably discuss that at our next meeting with the community group. But yeah, no, it's because it takes away the mystery of the room in the area,
Sure.
because it's something out of their comfort zone, and if they've at least seen it or have an idea of what it might look like, it's going to help.
And we in the past have done video modeling with my son, where I would go to an environment with, just video on the phone and walk through and narrate, hey, this is the door we're going to go into. This is, here's
Hmm.
Michael. You're going to meet Michael when you walk in, or, whatever that may look
Right.
like,
Yep.
and showing him the visual of the room as I was narrating that video and showing that video to him daily and sending that video to his school when he was in school. Those kind of resources make a big difference, right, for someone. So I'm really
Absolutely. They
happy that
absolutely do.
you're embracing that and supporting individuals and families through that process. We do have someone asking about some medication. So if someone is going to get medication prior to their visit, uh,
Hmm.
just for calming purposes or sedation purpose, I don't know if I would say sedation purposes, but for calming reasons, is
Yeah.
that something that you would prescribe, the primary care doctor would prescribe, or the
That's
prescribing
gonna come
doctor?
from their primary. That'll
Okay.
be their primary. This is outpatient, so they're not gonna be seeing a provider or anything like that. So that would have to come from their primary, or, one of the doctors that they're seeing.
Okay.
That's not something that we can provide them, nor would we, when we get into there, be able to do anything for sedation or anything like that. It is totally, just through, um, the environment, and working with the patient and keeping them as calm and cool of an area as we can.
Great. And I know that there was an insurance component to that question. So that hopefully that doctor's office would have a patient advocate if the insurance is not paying for that to help you really relay the need for that, right?
Yeah, insurance for like a pre-medication.
Yes.
Yeah, that would be totally addressed by them prior. Like, we'll ask about it, and the other part we'll do is, what happened on your previous attempts? Like, when you went to an outpatient or whatever, how'd it go? What happened? Like, what was going on? Now, I mean, anybody that's gone for lab work outside of, in any of those outpatient places, it's bright, it's loud, it's very crowded, and it's hectic. So we get that side of it, but and generally they'll say they tried 7, 8 times to get the blood and they weren't successful. So we take all that, we get all that information, we take that into consideration.
Great. Great. So I'm going to bring up, so again, everyone will receive Sherry's and Michael's contacts in the follow-up slides that we're going to send an email over the next week along with the recording. And this is how you can reach out to CLEP. Natalie Trumps. Again, my name is Melanie McGacken. Our phone numbers are on there. Our whole CLEP team's emails are on the screen, and feel free to take a quick photo of that QR code, or you can use the link that's going to come in a follow-up email if you're interested in receiving any of our newsletters or information on upcoming webinars, such as the one that we hosted today. And prior to you signing off, you're going to see a quick evaluation, or you can even use this QR code on your screen. The evaluation takes about 30 seconds, and it's information that you provide us that better allows us to serve the community moving forward based on the topics that are going to be most relevant to you. So I will stop share. And Michael, I do want to just take a moment again. Thank you and the Shore Medical team for doing all that you're doing and really recognizing the need in our community to better support people with different sensory needs. So
Thank you guys very much for allowing us to come out and talk with everybody, and looking forward to working with anybody who wants to reach out. Thank you guys. And thank you for all the great questions too.
Yeah, and thank you again for your time and your expertise.
Of course.
And we'll be in touch soon, I'm sure.
Sounds great. Thanks,
Thank
Melanie.
you. Be well.
All righty. Bye-bye.
Bye. Thank you, everyone.